Shocking revelation. Children face higher heart and inflammation risks from COVID-19 infection than from vaccination. A groundbreaking study, the largest of its kind in children and adolescents, has revealed startling insights into how COVID-19 impacts young hearts. Published in the Lancet Child and Adolescent Health, this research was led by top scientists from the universities of Cambridge and Edinburgh, alongside University College London, with support from the BHF Data Science Centre at Health Data Research UK. Here's what makes this study so significant. Researchers conducted a whole population analysis during the pandemic and found that while severe heart and inflammatory conditions in children were rare, the likelihood of experiencing such complications was significantly higher after contracting COVID-19 than after receiving a vaccine. Even more concerning, the elevated risk after infection persisted for much longer than any risks observed post-vaccination. Dr. Alexia Sampri, the study's principal author from the University of Cambridge, emphasized, although these conditions are uncommon, our research clearly shows that COVID-19 infection poses a longer-lasting and higher risk of heart, vascular, and inflammatory issues in children and young people compared to vaccination. To reach these conclusions, the team analyzed linked electronic health records, EHRs, for nearly 14 million children under 18 in England, covering 98% of this population between January 1, 2020 and December 31, 2022. During this period, 3.9 million children received their first COVID-19 diagnosis, and 3.4 million received the Pfizer-BioNTech vaccine, BNT162b2, the main vaccine administered to 5 to 18-year-olds at the time. All personally identifying information was removed, and the data was accessed securely through the NHS England Secure Data Environment, SDE, ensuring confidentiality while allowing detailed population-level analysis. The study specifically examined short and long-term risks of rare but serious complications, including arterial and venous thrombosis, blood clots, thrombocytopenia, low platelet counts, myocarditis or pericarditis, inflammation of the heart or its surrounding tissue, and other inflammatory conditions following either COVID-19 infection or vaccination. The findings were clear. After a first COVID-19 infection, the risk for these conditions was highest during the first 4 weeks, and for some conditions, remained elevated for up to 12 months, compared to children without or before infection. In contrast, following vaccination, an increased risk was observed only for myocarditis or pericarditis during the first 4 weeks, after which the risk returned to baseline levels. Over a 6-month period, the team estimated that COVID-19 infection led to 2.24 additional cases of myocarditis or pericarditis per 100,000 children. For vaccinated children, the number was significantly lower at 0.85 additional cases per 100,000. Previous studies have indicated that children with COVID-19 are at higher risk for myocarditis, pericarditis, and thrombocytopenia than their peers who never had the infection. This research, however, is the first to directly compare the long-term risks of COVID-19 infection versus vaccination in this population. Professor Pia Hartelid, co-author from UCL and the National Institute of Health and Care Research at Great Ormond Street Hospital, explained, parents and carers have faced incredibly tough choices throughout the pandemic. By providing a clearer understanding of both infection and vaccination outcomes, we aim to help families and healthcare professionals make decisions based on the best available evidence. Professor Angela Wood, University of Cambridge and Associate Director at the BHF Data Science Centre, added, by analysing health records for every child in England, we could study very rare but serious heart and clotting issues. Our results show that risks after COVID-19 infection are higher and last longer than the risks after vaccination. While vaccine-related complications remain rare and short-lived, infection risks could change with new variants and evolving immunity, highlighting the need for continuous population-level health monitoring. Professor William Whiteley from the University of Edinburgh emphasized, families need trustworthy information to make health decisions. Hospital and GP data give us a comprehensive picture of how children have been affected. During the pandemic, risks of myocarditis and inflammatory illnesses were generally low, and vaccination posed fewer risks than infection. Controversial takeaway. While vaccines may cause rare myocarditis cases in young people, especially with mRNA vaccines, the evidence now shows that COVID-19 infection itself carries higher and longer-lasting risks. Does this mean the long-debated concerns about vaccine safety should be reevaluated in the context of infection risks? We want to hear your thoughts in the comments.
Source: Saint-Prix, A. et al. 2025.
Vascular and inflammatory diseases after COVID-19 infection and vaccination in children and young people in England, a retrospective, population-based cohort study using linked electronic health records. The Lancet Child and Adolescent Health.
2 ori 10, 1016 să 2352-4642, 25 0024770.